We, Spritle Software, have started this initiative to set our paths and footprints in the digital healthcare domain. To start off with this new journey, the webinar will be flowing with information about the digital healthcare anesthesiology. So let's welcome our speaker for today, Dr. Raj Sethuraman. Hi, doctor. How are you?
Fine, thanks. Thanks, Vashini. You all right?
Yeah, we are all fine here. Thank you. It is great to hear from you, sir. Spritle welcomes you with a big thanks, firstly. And you're the first speaker of this journey who've joined us, and you'll always have that privilege with you.
Thanks for the invite. I am honored to be invited for this talk. It's my pleasure.
Yeah. Okay. Moving on. About our speaker. So Dr. Raj Sethuraman, he is a consultant anesthetist with special interest in thoracic and regional anesthesia at Nottingham University Hospitals NHS Trust, England, UK. He has completed his MBBS at Madras Medical College, Chennai, Tamil Nadu, India, and Diploma in Anesthesia at Madurai, Tamil Nadu, India. He has also completed Fellow of the Royal College of Anesthetists, FRCA, at Royal College of Anesthetists, London, UK, and a European Diploma in Regional Anesthesia at the European Society of Regional Anesthesia, ESRA, Geneva, Switzerland, and Europe. We are very honored and very happy to have you today with us, doctor. Okay. Moving on. The agenda of our webinar will be, we'll have a 30-minute interview with Dr. Raj Sethuraman, and finally save your doubts, because the last 15 minutes will be an interactive Q&A session with the speaker. You can ask him any questions and our speaker will be very glad to answer you guys. Okay, moving on, let's start our interview with Dr. Raj Sethuraman. Doctor, how do you think the patient's status is monitored when the anesthetic is injected into the patient?
Okay, yeah, fantastic. A nice question to start the session. Before I start answering Vashini, because this is the first time, I think after a long time, I am speaking in front of a non-medical audience.
Oh.
So if I say any medical term which you think it will be difficult for the audience, please stop me and ask me to explain that. But I will try to keep it really simple so that everyone could understand. But I have to consciously make that effort, because definitely one or two medical terms will just come out. Okay.
Yeah, sure.
Yeah. So okay. So. So monitoring is, one of the fundamentals of anesthetic practice. Like when a patient first comes into theater, let's say for a tonsillectomy, shall we say, which is an operation everyone could understand. The first thing we do is we double check the patient's name and their date of birth, just to confirm their identity and making sure that they are coming for the correct operation. And the first thing we do is the anesthetic practitioner who will be helping me to get the patient off to sleep. What they will do is they will connect the patient to all different sorts of monitoring. Okay. So the monitoring we use, we have some basic monitoring, which everyone gets when they come for their operation. And there are some advanced monitoring, which we will use in special situations if they come for a really complex operation, or if the patient has complex medical needs. Okay, so for an operation like tonsillectomy, we will be using basic monitoring. So I will list them one by one. Actually, you can split the monitoring into into different categories. So we will be using one or two monitor to monitor each of the vital organs. So our body has a few vital organs. We got a lot of organs, but a few organs are vital for the functioning of the body. These are all the organs we're monitoring. So starting with the brain, so the brain is the first and foremost organ. So we'll be starting with the brain monitoring. So we have got two different kinds of monitor to monitor the brain. We will be using one or the other. Both these monitors have got complex algorithms built into the monitor, and they come up with software updates every few years to increase the level of monitoring that we can do. So one of the commonly used brain monitor in UK, I'm sure in India as well, would be something called BIS, B-I-S. It is called bispectral index monitoring, which is basically, every organ in the body has some kind of electrical activity as a baseline, which differs from organ to organ. So the electrical activity of the brain can be measured very accurately on the surface of the brain, but you can also measure them on the surface of the body, because electrical activity from inside the brain will make their way to the outside of the body. So we can measure the brain activity by putting some electrodes on the forehead. So what it basically measures is something called EEG. I think people would have heard. It's electroencephalography to measure the brain activity. So it is a complex waveform. If you look at the raw EEG, there will be like 10 to 15 different waveforms to tell us what the different areas of the brain is doing. And in anesthetic practice, it will be difficult to go through every wave and to establish what the brain is doing. So what this company has come up with is they process all the EEG, and then they just give us one waveform, and also it comes up with the digital number. So for example, if I put a BIS monitoring on someone like you and me who are awake and talking, it will show us a number of around 98 to 99. It can go up to 100, which means the patient is fully awake. So when the patient goes to sleep, we expect the number to drop down to less than 60 and stay between 40 and 60 for the duration of the anesthetic, which means they are adequately asleep for the operation. It also helps us to avoid overdoing the anesthetic. For example, if the BIS number drops to less than 40, then means patient is getting too much anesthetic, then we can titrate the amount of medicine we can give. So this is the brain monitor, okay? And there is another kind of brain monitor called narcotrend, which is gaining impetus in the last couple of years. Some places might be using that monitor, which is also a processed EEG. So this is to monitor the brain. And this is a very clever monitor, which has got complex algorithms inside to summate all the EEG and to come up with one waveform with one number, which is easy to understand for anyone. So the second is a heart monitor, which is ECG. Okay, so just the middle letter is different. So we will be attaching the ECG electrodes to look at what heart is doing. So that's another monitor. So monitor number 2. So the monitor number 3 is a breathing monitor to check at the amount of oxygen which is in the body. And there is also another monitor called capnography, which helps us to measure the amount of carbon dioxide which is coming out. So we measure both components of breathing. So we measure the level of oxygen in the body. We will also measure the amount of carbon dioxide coming out. So these are all the basic monitoring which we will be doing for any operation. But depending upon patient's own medical problems, and if for complex procedures, we will be using sometimes a lot of additional monitoring as well. I don't want to go into that because I think it will be beyond the scope of this talk.
Okay. I have a question. Like, does the injection of the anesthetic varies for the pediatrics and geriatrics?
Yes, so that's a really good question. I mean, when we say injecting the anesthetic, I mean, I can inject the anesthetic myself with my hand using a syringe. But in our hospital, especially, about 80% of anesthetic, what we use is called target-controlled infusion. Okay, So instead of me injecting the anesthetic with my hand, we will be loading the syringes onto a syringe pump, which you can call it a machine as well. So basically, they are syringe drivers with the inbuilt microchip. So what we do is we draw up the anesthetic, which are two drugs basically, propofol and remifentanil. So we load the syringes onto those syringe driver, and then we input the patient's age, weight, height, and then I think you can call it software, or you could call it like basic artificial intelligence. So what the syringe driver does is, so they got algorithm inside the syringe driver based upon thousands and thousands of patients of different age, height, and body weight. And then the syringe driver calculates how much dose to give that particular patient, depending upon the details I inputted. So, and so even as soon as I turn the pump on, it will ask me, do I want to use the pediatric setup or adult setup? So I have to press my choice first, and then I have to put the patient's age and name and date of birth. So machine does automatic adjustment depending upon the patient's age. And so this is one end of the system. The other end of the system is the brain monitor. So we input the patient's details, and then the syringe driver it kind of decides how much drug to give. And then we measure the effect with the use of the brain monitor. We just make sure that that this number is within the normal range we would want. That's how it is done. But if I'm doing it with my hand, then I would definitely adjust the dosage of anesthetic depending upon the patient's height and body weight, of course.
Thank you so much for the information. So moving on, the next question will be, what are the kind of technologies that you're currently using in anesthesiology, like in real life scenarios?
Yeah, fantastic. So, we can't, as an anesthetist, we can't live without gadgets. Okay, so two of the technologies which I just mentioned, this syringe drivers giving the desired amount of anesthetic to the patient, which has got algorithm inside, and the brain monitor, which I just mentioned, so all the monitoring comes in a one big screen. So it has got, it's like a split screen with the different sections of the screen for each thing we are monitoring, like heart rate, blood pressure, respiratory rate, and the brain index and everything. And whenever the values go out of the range, we get an alarm so that we can adjust. So that is which I just mentioned. But if you look at a patient pathway coming for an operation, we can divide into three stages. So first is the pre-operative period, so which is called the pre-anesthetic assessment. So we have to, before we bring the patient into theater, we have to make sure the patient is fit to have the operation. So that is the most one of the most important aspect of anesthetic practice, which is pre-operative assessment. In our hospital, we have, in the last few months, we have moved on to like a digital pre-operative assessment. So before that, it would be done on paper. Now what happens is, most of the time, if the patients are, fairly straightforward, the pre-operative assessment is done over the phone. So one of the nurses will ring them on their mobile phone and then ask the details, and then they will be inputting all the details into that digital pre-operative assessment platform under the particular patient's identification. And then, so once they input all the patient history and their medications and their, height, weight, and everything, so it comes up with the summary. So it will tell us whether there is any variance, whether we need to address something before the patient comes for the operation, and it will also tell us what medications they are taking and whether they need to be adjusted. Or sometimes it even tells the patient has got more than a few medical problems, which means they'll have to come into hospital to have the thorough preoperative assessment. So we got this digital preoperative assessment, which is in the preoperative phase. And if you come to the operating theater, I already mentioned, these syringe drivers and the monitoring. We also use ultrasound technology to do quite a lot of procedures.
Yeah.
If you go back 20 years, most of the procedures are done using landmark technique, where we do the procedures based upon the knowledge of our anatomy. We feel for the pulse from outside and we do it. We do the procedures, or we feel for a bony landmark and then we do the procedure. But nowadays we have ultrasound technology which helps us to look inside, and then we can be more accurate on the procedure, and it becomes really safe. That's one of the other technology. If you go to the post-operative period where the patient's fit and they had their operation, then they go into the recovery room and they are on the ward, we can monitor their vital parameters again, like heart rate and blood pressure, and the nurses will put those numbers into an app, and then if it goes, it becomes abnormal. So every parameter has got a scoring system. So the heart rate will have 0 to 5, and the blood pressure and their breathing. If if the numbers become abnormal, so the patient hits a certain score, and the doctor gets an alert automatically. Even though they are not on the ward, they will get an alert automatically. It's called early warning score. So then they can go and see the patient. So the nurses don't have to pick up the phone and ring the doctor. They can, if they want to get the doctor to see the patient anyway, even if the scores are low.
Okay.
The system is built in such that the doctor gets an alert automatically.
Yeah.
So this is another technology, and there are also electronic patient records. I mean, different hospitals do it different way. The traditionally doctors and nurses have been using pen and paper to write, and how difficult it can be to read someone's handwriting. So and to the papers go missing and all of that. So in terms of digital patient record, there are two ways hospitals are doing. Some hospitals have through and through complete digital or electronic patient record, where all the entries are done into the computer then and there, and nothing is in paper. And some hospitals use the paper format when the patient is in hospital. So doctors and nurses write, and then in a periodic basis, they keep uploading those papers onto the computer. So the records become digitized. So in this, you still have to, read someone's handwriting, but at least you can be sure that, the papers are not going to go missing. And you can also categorize in the computer. These are the investigation, these are the anesthetic records, these are the surgeon's record. So if for example, the patient's record can run into sometimes hundreds and thousands of pages. If I open a record, you can guess how long it will take me to find a particular piece of information. But if they are categorized nicely on the computer, I can, for example, I'm an anesthetist. I would be interested in looking at the anesthetic record. I can just go to the anesthetic tab and look at what I want. So these are some, I can go on, all day, but for time's sake, I'll stop there, and I think we could move to the next question.
Yeah, sure. Okay. The pain points in your profession, like the difficult situations that you would have handled in a real life scenario, you think a software can fix all those?
Of course, yeah. So again, if I start from if we go according to the patient's pathway where they are at, if you take pre-op assessment, I mentioned just now that we got a digital pre-op assessment where the nurses ring the patient and go through 50 to 60 questions to do the pre-operative fitness. I mean, you can take this to another level where you can develop an app. Obviously, not all patients are versatile with smartphone and handling the app. But majority of patients these days, if they are less than 60 or 65 years old, everyone is using mobile phone in the day-to-day life. So you can build an app so that instead of the nurses calling the patient, you just give a patient a password. They just need to log into the app and they can put the details themselves. So it will be simple questions like, do you have chest pain? Do you have blood pressure? They just have to tick yes or no. And then if they are on medication, they just have to write the number of medication. So they can do it themselves. And then, they can also check their height, weight, and blood pressure locally. They don't have to go to the hospital to get that done. So they can input their own height, weight, and blood pressure and things like that. And one of the key aspects of preoperative assessment, which we do, is airway assessment, because when someone goes to sleep, we take over their breathing. Yeah. So to do that, we have to put a breathing tube inside the mouth when they are asleep. And we have to check that it is going to be easy or difficult to put the breathing tube, because not everyone anatomy is the same. So this is something we do it in person. This can be done remotely, for example, a video conference call. They don't have to come into hospital. But I think there are apps in development. It's like face recognition apps. I think they're trying to build airway recognition apps. So if the patient just look at the app, it will ask the patient to do few maneuvers, look straight forward, look up, look down, open the mouth, and do things like that. And then the app will come up with this airway score. So all the pre-op assessment can be done remotely, and we can use artificial intelligence to find the variance. If somebody is taking some medication which needs to be adjusted, and then the app can come up with a summary and things needs to be done and send it to the hospital, which will save quite a bit of time. So obviously this won't be possible to do in every patient. They have to be quite agile, and they should be able to handle the and things like that. But it can be done, I am sure, for majority of patients. So this is one. And other aspect which will definitely have a huge implication is teaching and training the trainee doctors. So in terms of learning a procedure, as an anesthetist, we do quite a lot of procedures. We cannulate the vein, we put cannula into the artery. We do, spinal injections and epidural injections in the back. We do nerve blocks. We put, central venous catheters into bigger veins to give special medication. So we do quite a lot of procedures. So traditionally, how the doctors learn is, the trainee doctors come to theater, they watch 6 to 7 procedures, and then they help with 6 to 7 procedures, and then they do another few procedures under direct supervision, and then they can do it on their own. But if we can have virtual reality software systems which can simulate a real life dummy, if you can imagine that, and the doctors can practice on that before they come and learn physically in the operating theater. And with the software adjustment, you can change the anatomy as well. You can have a easy setting, moderate setting, and difficult setting, so that the doctor can practice the easy procedures and how it becomes difficult in a difficult patient. You can increase the we call it body mass index. We can make the patient bigger and smaller, and so all kind of scenarios can be learned in a virtual reality mode. So this is one of the thing which could be done. And coming back to one of the thing which we do quite a lot in anesthetic practice is giving drugs. And drug error, by drug error I mean giving wrong drug or giving an incorrect dose, is one of the commonest human errors we have in this industry. So we can develop automated drug carts, so we have a drug cart with all the drugs we use completely locked. And when a patient comes in, you have to input the patient's details, height, and allergies. And if the patient is allergic to certain medicine, then you can make the software such that that cupboard, that drawer can lock itself. And it can remain locked for the duration of the operation. The doctor won't be able to pick up the drug and give it to the patient. So this is will be an inbuilt safety mechanism. And also, when a drug is taken out, and before we give it, if we scan the syringe to the patient's ID, the machine can self-document what drug was taken and given instead of we having to write. So sometimes we give the correct drug, but we may write the incorrect name or incorrect dose. Sometimes due to human error, we may even forget to write that the drug was given. So by making this automated drug cart, it takes that human element out of the equation. So this is one of the technologies which could come. I mentioned about using ultrasound to do a lot of procedures. There are a lot of developments, I'm sure, on the horizon in the ultrasound technology to make it more user friendly, to use them better for a better safety of the patient. So again, I could go on and on. We are greedy people who would like to have the life as simple as possible. With these automated technologies and machines, but I would never dare to say I would want to replace an anesthetist with a machine. I know people have tried it before in Canada and America, but it never really taken off. But yeah, I will stop there. You can move on to next question. If you have any questions, you can ask.
So finally, in what ways can the anesthesiologist and the software industry people can work together and come up with new ideas to solve all the pain points you just mentioned?
Yeah, I mean, I mentioned quite a few issues in my answer to the previous question. So I'm sure there is quite a lot of opportunities in terms of software development and use of artificial intelligence to make the life easier. And one of the things which we really strive to excel is risk prediction. Okay, it's like when in our culture, people go for wedding, they look at the horoscope to see how these couples will cope in 5 years, 10 years time. Same kind of thing. If a patient comes for an operation, you need to know with some degree of certainty whether the body is going to cope with that operation and they are going to do well after the operation. So we have quite a lot of risk prediction models. So there are two kinds of risk prediction. One is pre-operative risk prediction, and one is post-operative outcome prediction. So in terms of pre-operative risk prediction, I mentioned about this apps where we can put all the where a nurse or a doctor or a patient can themselves put all the details in, and then it will come up with the pre-op summary. Even in that model, you can make an inbuilt risk prediction to tell us how the patient is going to do after the operation. The patients can decide, like if the app tells there is a 5% risk of death after the operation, or 10% risk of death after the operation, or if the app says there is 20% chance of getting a heart attack, then the patient can decide for themselves whether they want to go for the operation or not, and the doctors can adjust things to reduce the risk. So these risk prediction models, they have thousands and thousands of patient information from the past inbuilt into them. So it learns how those patients did to give an outcome prediction for our patient in interest. And on the same note, depending upon how the patient's parameters are maintained during the operation, then it can give a risk of post-operative events which might occur. For example, if the patient became hypotensive, or if the patient's oxygen level drops, or if they didn't make enough urine or something like that during the operation, then it can, even before the patient comes out of the operating room, we can decide whether the patient is at risk of going for post-operative, stroke or heart attack or kidney failure or things like that. So this is this is something which software industry can work on. There are risk prediction models already there, but there's always room for improvement and make it more precise. Yeah. But having said all of this, as I said before, I mean, nothing can replace a human anesthetist or a human doctor in the room. When we talk about artificial intelligence in anesthesia, people immediately think, oh, anesthetic is going to be done by a robot, and we don't need an anesthetist in the operating room. As I said, people have tried that, and it never really took off. You still need someone to work the machine. But what the technology can do is can make our whatever we do much safer for the patient, to take as much human error out of the equation as possible, so that we can give good outcomes for our patient.
Okay. Can you summarize few important parameters to be considered by an software developer? You should consider these points. These are the main points you come to your mind first while you develop something.
Yes. I mean, first we have to understand what the hospital or what the department is after. Like a healthcare setting is different in different parts of the world. Even it differs from hospital to hospital. So every hospital or every department has their own needs and their own challenges which they will want to address. So we have to understand what they're after. And in anesthetic, whatever we do is underpinned by safety. So, I mean, next to airline industry, anesthetic industry is well known to underpin safety in whatever we do. So even if a software doesn't come up with the perfect solution to a problem, it shouldn't compromise on safety aspects. So I would say that should be the one of the key points in terms of any artificial intelligence or software development, because we all know this Boeing Max airline crash, where in spite of the pilot trying to save the plane, I'm not an expert in artificial intelligence, that they couldn't override apparently the AI application. So So those kind of safety mechanisms have to be the the backbone of whatever software we are developing.
Thank you so much, Doctor. It was very informative. Okay, now moving on to the Q&A session. Participants, you can ask your questions to our speaker now.
Hi Raj. So we really had an informative session, and I'm glad that I have joined here. So coming to a question, can you please let us know what mobile apps you would recommend to keep our health group?
I can't hear Vashini. Did you get the question?
Hi Raj. So can you hear me right?
Yes, yeah.
Yeah, actually, it was a really informative session, and I'm glad that I have joined here. So, coming to my question, can you please let us know what mobile app you would recommend to keep our health good?
Mobile app. Well, there are a lot of mobile apps around which can track your daily exercise, daily nutrition intake, and you can keep a tab on your blood pressure and heart rate and blood sugar. It can give you change in trend over a period of time. Personally, I just use whatever health app comes with my phone. So you just have to find some app which will fit your requirements. So that's what I would say.
Okay, thank you, Raj. So what type of app you are using currently?
You're on mute.
So may I know which app are you using right now?
Sorry? What was the question?
So can you hear me now? So which app are you currently using?
I am. I've got a Samsung Galaxy phone, so I use the health app which comes with that app.
Okay. Thank you, Raj.
No problem.
Hello, sir.
Yes.
Hello, sir. Siva here.
Yeah, I can hear you. Yeah.
Yeah. First of all, knowledgeable section, and you gave an excellent answer about digital healthcare, sir. I hope people like me from non-medical background learn few medical terminology today. And I have a quick question for you, sir.
Yeah, go ahead.
Today, medical devices are advanced and real-time remote monitoring is possible.
Yeah,
So,
of course, yeah.
How will this change your future of digital consulting, sir?
Well, I think after the pandemic started, so much is being done remotely. Like before the start of the pandemic, even in our hospital, all the outpatient appointments, patient will come to the hospital, see the doctor face to face. And because of the pandemic, we had to stop. We have to keep only essential people movement. So most of the consultations are done remotely, and as I said, the assessing fitness of a patient for an operation is if the patient is fairly straightforward, is done remotely over the phone. And these cardiac patients, sometimes they have the artificial pacemaker and things like that to support their heart. Their performance for a long time has been monitored remotely from their home. And also, we try to we don't want to keep the patients in hospital unnecessarily. So a patient comes for an operation, let's say, a hernia or something like that, and or a knee replacement or an arthroscopy in the knee. you don't want to keep the patient in the hospital for any longer than necessary, because each day they stay in the hospital, it is unnecessary risk of infection, and their mobility is restricted, so they can get the blood clots in the legs and things like that. So the idea is to send the patients home as quickly as possible. At the same time, you don't want to compromise the safety by sending them home earlier. So what you can do is you can do the post-operative follow-up remotely from patients' home. So when the patients get home, they can upload their heart rate and blood pressure and the oxygen levels and the amount of pain they are in and the medication they are taking twice a day on an app, and the hospitals can review it remotely. As long as everything is going smoothly, then we can follow them up for 4 days or 5 days, and then discharge them remotely, and they can go back to their own community care. But if something is not going in the right direction, then we can ask them to come into the hospital. In that way, we can reduce the amount of hospital stay for the patient. At the same time, we can also keep them in a safe environment rather remotely.
Okay, sir. Okay. A couple of weeks before, I read a blog regarding digital consulting. So you gave an excellent explanation, sir. Now I'm clear.
Thanks, Siva. Thank you.
Thanks.
Any more questions?
Yeah. Yasni, I'm Karthik here, so I have one question.
Yeah.
Hi, sir. Actually, myself Karthik. So I have one question with how is patient data protected in UK? We have a HIPAA complaints in US. So is there any medical complaints in UK, sir?
Medical complaints.
Yeah.
I mean,
So we have,
what?
Yeah.
Do you mean like patients complaining about the care they received? Is that what you mean?
No, the regulations, he's saying.
Regulations.
Complaints. Oh, yeah. So yes. So whatever medical device or whatever software coming into the healthcare industry has to be approved by an agency called MHRA in the UK. It's called Medicines Health and Regulations Agency. So any new technology, for example, brain monitor or a heart monitor, the MHRA was the first healthcare agency to approve the COVID vaccine in the whole world. I mean, even though the vaccines were developed in Europe and North America, the first vaccine, the Pfizer-BioNTech, and the Moderna vaccine, the Pfizer vaccine, BioNTech vaccine was first approved by the MHRA. Even though it was an emergency approval, it was an approval. So whatever we develop has to go through them before it comes into day-to-day use for patient care.
Okay, understand. Another question is, so how they protect the patient's data, sir, in UK?
Well, it is all National Health Service platforms are highly secure and encrypted. I don't know that technological details of how it is kept secure, but I know that they are kept secure. And once in a while there have been hacking attempts. It happened, I think, maybe 2 years ago. They kind of hacked into some of the hospitals, electronic patient record systems. But I mean, what can I say? I mean, like encryption gets clever, and the thieves also get more clever. So it is a constant, job of keeping yourself up to date than people out there who are trying to steal your information.
Okay, understand, sir. Okay, sir. Thank you, sir. Thank you for your comments.
Any more questions?
Hi, good afternoon, doctor.
Yeah.
My name is Sriram. First of all, thank you for this very exciting and insightful session. We learned a lot today. My question to you is how important is the history of a patient, his pre-existing or genetic conditions, or his what is allergic to this, allergic conditions. All these conditions are very important while an anesthetist is performing in a surgery table. Now, if we want to build an autonomous system which might look into overriding this, how important are these factors? Why I'm asking this is we have kind of built an application for the last few years which dwells deep into the prehistoric conditions and the personal details of the patient. Can this data be helpful while we are building an AI system for the decision support of what kind of drug to give, what dosage to give in a surgery?
Of course. I mean, for every question that Vashni asked me, I started off with the preoperative assessment. So the preoperative assessment is one of the key element of anesthetic practice. So we establish what medical problems the patients have, and then we make preoperative adjustment. People call it, preoperative conditioning. So we try to minimize the risk as much as possible in the preoperative setting. And then after that, when the patients come to the operation, for example, if someone has, a previous heart attack, or if they had, previous stroke, then it means their blood pressure requirements will be slightly different than the rest of the population. For example, their blood pressure will have to be kept slightly higher, which is higher for the other people, but it might be normal for them. So we have to blood pressure within the normal range for that particular patient. So what we can do is we don't have that much that kind of technology yet in our practice. So you can input the required parameters into the monitor even before you start your anesthetic. So if you are going to deviate from those parameters, then the machine can alert you that you are maintaining a lower blood pressure than what is needed for the patient, and it can also come up the reasons. So it can be an added safety feature for sure.
Great, doctor. Because you just mentioned the human error that might happen in a surgery table would be the wrong dosage or the wrong medicine based on his allergic reactions. So if a system is able to automate that part of it, maybe that could help to avoid those human errors.
Absolutely, yeah.
The entire situation. Great.
Yeah.
That sounds interesting. Thank you, doctor.
Yeah, absolutely. Yeah, thank you.
Thank you, Shweta. And any more questions?
Hi, good afternoon, sir.
Hello.
Sir, I have a question on it. First of all, thank you for a wonderful section, sir.
No problem.
May I know how Taken A has its application in OT, and ICU environment, sir?
The bit of background noise.
Okay, sir. Am I audible now?
Yeah.
How Taken A has its practical application in ICU environment, sir?
Is the question how technology has an application in ICU environment? Is that the question?
Yes. Taken A has its practical application, sir, in ICU.
Yeah, ICU is, that's another huge topic.
Yes, sir.
A lot of things can be, automated, and the softwares can be developed for so many things. You can take from, ventilation. Ventilation is one of the basic aspects of patient care in intensive care. So a lot of advancements in ventilation have come to give different modes of ventilation for a particular patient. So those kind of things, and this automated drug carts we mentioned because in ICU environment they use innumerable number of drugs, several times more than what we use in anesthetic practice. So the chances of a drug error is even more so in ICU environment. So these kind of automated drug cards, personalized to each patient, can be of much use. And these risk prediction models can also be of much use in the ICU environment. Because you admit a patient to ICU, you want to know with some degree of certainty how they are going to do, whether the ICU care is going to be useful for them. Because you don't want to admit the patient to ICU if the prediction says the chances of them not doing very well is very high. So it will be it wouldn't be in the best interest of the patient, and it wouldn't be in the wouldn't be best use of resources either. So these kind of risk prediction can be dynamic and ongoing even when the patient is inside the ICU. And the electronic prescribing, like doctor do quite a lot of prescription in ICU, and the doctors change all the time. So all the prescriptions can be done on the computer, which can come up with the right drug and the right dose, eliminating any kind of human errors. So yeah, I mean, the technology has a big role to play in ICU setting.
Thank you, sir, for your great insights. We will be developing on it, sir. Thank you, sir.
Hi,
Hello,
doctor.
doctor. Yeah, go ahead.
No problem. Go ahead, please.
Okay. Good afternoon, doctor. So I have a question regarding the security violations, which is a sensitive and productive data, because a patient history is a confident one, right? So have you come across about a data breach, like a data thefting or stealing? So how impact it was in your organization?
Well, I personally never had any data breach problems, and we never had any problems where I work either. But it is a very sensitive issue. I mean, one of the questions Vashni asked me was, what is the first thing the developers should focus when they develop an app? I would say safety and data security, because any information to do with the patient care is extremely sensitive, and only people who have legitimate reasons to access that should access it. So, as I said, I mean, people get more clever with the data security, and we just have to keep up to date with the people who try to hack the systems, and there shouldn't be any kind of data leakage in the because of error with how the program was developed either. So yeah, but I personally never come across any data breach problems where I work.
Okay, thank you, doctor.
Dr. Raj, one last question from Dr. Rima. She really wants to ask you one question.
Yeah.
Dr. Rima, you can ask your question to a speaker.
I think Dr. Rima left the meeting, so considering the time, maybe we can wrap up.
Okay, sure, sir. Thank you, participants. Thank you for your questions. They were really informative. And thank you, Dr. Raj Sethuraman, for your time and for this wonderful webinar. We hope to connect with you again very soon in the near future for another session like this one. Thank you so much.
Thanks for inviting me. It's an honor. Thanks a lot.
Actually, I'm really sorry. I got a call in between, so I had to leave. I'm Rima. I'm working as an occupational therapist in Sri Ramachandra University, Porur, and I happened to join this meet. So it was a wonderful session. I would like to thank you, doctor. My question is very simple, as I'm from a medical professional. My question is very simple. So, what are the challenges that you had or you may face in the future as a medical practitioner when you use an online consultancy, or you consult patients online, or you dispense drugs online? So that is all.
I mean, obviously, when you do an online consultation, there is some limitation. Like you cannot get close to a patient. You can't do much physical examination. So that's one of the limitation. For example, you can't listen to a patient's heart to check for any so I don't know. In future, iPad might come up with the stethoscope app, so you can listen to a patient's heartbeat remotely, or a patient's breathing sounds remotely. So that's one of the challenges. We can't get close to a patient, and not sometimes after doing an online consultation, then you will feel that I need to see the patient face to face, and if that is the case, then you have to bring the patient, or you need to get to them. In terms of online medical dispensing. If it is done electronically, then hopefully the room for error should be very minimal. For example, if you already input the allergy status of the patient, then the app or system shouldn't let you prescribe those kind of medication. And if you put the patient's correct age and body weight, then the system has to be built such that you shouldn't be able to prescribe any abnormal dosage for the particular patient. And you can also input, if the patients had any liver problem or if they had any kidney problem. Once you input all the information to the prescribing app, for example, the age, height, weight, allergy status, whether they have got any kidney problem, liver problem, and things like that, then the system should be able to make automatic adjustment to minimize any human errors in dispensing the correct prescription.
Hello, Dr. Rima, is that all your doubts? Okay, I assume that is the end of the question.
She got disconnected for some reason.
Okay. Thank you so much, Dr. Raj, for your time. Thank you so much. And there are few announcements for the participants. You have the contact details of Dr. Rangaraj Sethuraman, his email ID. You can contact him anytime regarding your doubts in anesthesiology. He'll be very happy to connect with you guys. And secondly, there will be a feedback form given to you through the registered email ID. Please don't forget to fill it out and feel free to give any comments and suggestions so that we can improve ourselves. And lastly, I think that is all. Oh, okay. Yeah, sorry, forgot it. You'll be getting a certificate of participation also through the registered email ID. You can download it from the given link in the email itself. Thank you, participants. Thank you for attending this webinar. in your busy schedule and making this a very great success. Thank you so much. And thank you, Doctor.
Thanks, Vashini. It was a pleasure. See you all. You have a nice day.
Thank you so much.
Thank you, Doctor.